Hi, I'm Morgan. I'm a student nurse at Rhodes. I'm here to change your IV bag and also your tubing. I'm going to shut the door and provide for privacy. I'm going to wash my hands. Can I get your name and date of birth? And I'm going to compare that to my MAR and my physician order. We've got Jane Doe, date of birth 3/1/89, allergies, none and none, especially none to tape or latex. Our order says to 500 milliliters of 0.9% sodium chloride to infuse over 5 hours intravenously. And our MAR also says 500 milliliters, 0.9% sodium chloride to infuse over 5 hours intravenously. Okay. So then I'm just going to check her wristband for her name and date of birth, and then also confirm that she is not allergic to tape or latex. And then before I do my checks with my medication, I did the calculation of how many drops per minute. And we've got that here. So we are going to be doing 33 to 34 drops per minute. And also, here's my name bag. Okay. So before I do my first check, the first thing I'm going to do is I'm going to look at my solution, make sure it's clear. I'm going to make sure that the expiration date is 5/21 and it's clear and it's not leaking. Okay. Okay, so we're going to compare this to my MAR. The dose is 33 to 34 drops per minute. The route is intravenously. The time is now. The reason is for hydration. The individual is Jane Doe, and the medication is 0.9% sodium chloride. And before I do my second check, I'm going to compare it to what's currently hanging, which is the same 500 milliliters of 0.9% sodium chloride. Okay. And then I'm going to go into my second check. The dose is 33 to 34 drops per minute. The route is intravenously. The time is now. The reason is hydration. The individual is Jane Doe, and the medication is 0.9% sodium chloride. And then before my third check, I'm going to check the IV site, which it fell down. So we'll just put that back up there. And there's no signs of infiltration, no signs of phlebitis, no redness, swelling, pain, etc. So then I'm going to go and do my third check. So the dose is 33 to 34 drops per minute. The route is intravenously. The time is now. The reason is for hydration. The individual is Jane Doe, and the medication is 0.9% sodium chloride. Okay, so I'm going to put this aside. And then I'm also going to note that the tubing needs to be changed every 72 to 96 hours. And the IV bag also needs to be changed every 24 hours. And the tubing, the variation is based on the facility policy. Okay. So I'm going to go ahead and open this up. Okay, and the very first thing I'm going to do is close the roller clamp. Okay, and then we're going to spike it. And we're going to make sure that we don't touch this because this is sterile. I'm going to put that straight in. Oh, we don't want it to leak, but okay. Okay, then I'm going to go ahead and hang it. And then I'm going to fill this halfway. Okay. And then the first thing that we're going to do is we're going to put this into, we're going to prime our tubing. So I'm going to open the roller clamp. we go. Okay, we're just doing this to make sure that there's no air inside of there. Okay, and I'm going to go ahead and close that back off. Okay. And then now I'm going to remove all the tape. And this is where I would also make sure that I label the date and time that I'm changing this. Okay, so we're going to set that down. I'm going to go ahead and put gloves on because we're going to disconnect the old tubing. Alright, and I'm going to check the IV site. And before I remove it, I'm going to make sure that I close that clamp. Okay. Okay. And it's closed. Okay. And I'm going to remove this. And then hang this up. Okay. And then what I'm going to do next is I'm going to get an alcohol swab. And I'm going to scrub my J-loop for 15 seconds. Okay. And if this was an INT site, we would need to connect within 3 seconds so that blood wouldn't flow back. I'm going to unhook. I would put that back in, and I'm going to go ahead and secure it to their arm. All right. And then the next thing we're going to do is we're going to get this drip rate going. Okay, so since we need 33 to 34 drops per minute, I'm going to try and get 8 drops within 15 seconds. I'm going to slowly open it up. Slow it down a little bit. Okay, so I've got my 8. So the next thing I want to count it for a full minute. Okay, so I got 34 drops per minute. All right, I'm gonna make sure that that is stable. I'm gonna check the IV site one last time. Remove my gloves. Wash my hands. And then I'm going to make sure that my patient is comfortable. Lower the bed, cover him back up, etc. And then of course, I'm gonna go document that the patient tolerated the procedure well and the IV that was changed, etc.